There we go. If I can introduce myself, my name is Cole Craven. I'm the Director of Safety at TPM. And today we're going to talk about, the coronavirus, some updates to it with 2021. And then we're going to spend a good chunk of time on OSHA's emergency temporary standard. I'm going to try to present this in a way that's politics free and all that fun stuff, because my only concern is that my accounts know what they have to do to be compliant. Also, I'd like to state that today is November 18th, 2021. The reason why I'm stating that is the regulations of the standards can sometimes change by the day. So always try to keep it up to date, or you can give me a call if you're an association member, and I'm happy to help you. But before we get going with that, we could do some housekeeping items. In your upper right-hand corner, you should have an orange button with an arrow on it. And that's your grab tab, and that just opens or minimizes the menu. There is a webcam button. Default is off, so even if you turn yours on, I shouldn't see anything. There's a hand raise button, but really the best way if you want to communicate during the webinar is with the chat screen. And I'm just opening up the chat here. And what you do is you just figure out what you want to say, who you're going to send it to. You can send it to me, you can send it to another student, you can send it to everybody, and then just shoot it off. So I will watch that as we're going through the presentation, but this is very, very likely going to be a topic that you'll have questions afterwards, or you'll have questions, here in a month or two or something like that. So please don't be shy if you're an association member to give me a buzz. So what we're going to cover today is I'm going to talk about the coronavirus, COVID-19, and how it spreads and the symptoms and how to protect yourself. I know you guys have heard that probably ad nauseum, but I just want to make sure that somebody who's watching this later, or maybe even people on this presentation right now, have come to some of that foundation of understanding what it is. Then we're going to get into OSHA's emergency temporary standard. You'll probably hear me refer to it as ETS. What is that? What does it mean? Because there's a lot of scary articles and things like that, and I'm probably going to make some of your day, I'm also going to bum you out a little bit too, but we'll get to that in a bit. And then just how do we do it? What the heck do we do to be compliant? So SARS-CoV-2, that's the virus, and COVID-19 is the respiratory disease. Very, very, very similar to the influenza virus. It causes serious illness, including pneumonia, and then the new Delta variant is far more communicable and virulent. Depending on what statistics you read, it is 5 times easier to give somebody else, or 5 times easier for you to get. And it's primarily, though, spread person to person. You can be infected from close contact with an infected person, or from, when they're talking, they have spittle flying, and you may have it and never have shown a symptom. You didn't have a fever, you didn't have anything. And so distance is one of the things that they tell us to do. How do we protect ourselves? Well, that's distance in feet, but it's also distance in time, where you try to minimize the time you're in contact with somebody. Most of the time, though, it's your respiratory droplets from a sneeze or a cough. You can get it by touching infected or contaminated surfaces, and then touching your mouth, nose, or eyes. But that is not the primary way that this illness spreads. It is generally person to person. So the symptoms, this one changes just about every day. We're still learning about it, and its evolution is terrifyingly fast. And so, even with the vaccination, you could have a new generation of this virus and contract that as well. And so there's a broad range of symptoms. There's a massively broad range of symptoms on the recorded cases. And your symptoms generally appear 2 days to 2 weeks after your exposure. And those symptoms are like flu-like symptoms. Fever, cough, shortness of breath, headache, sore throat, loss of taste or smell, and there's a whole bunch of other ones. But the time to really get concerned is if you feel like it's affecting your ability to breathe. That shortness of breath thing, because it's it's not good. But an infected person may be asymptomatic. So you could catch it from somebody who seems perfectly fit, or they have very mild symptoms. It's I have had it, and my symptoms were not mild at all. I was worthless for about 2 weeks. My whole family had it. My son was sick for 2 days. So everybody's so different with this. And quite simply, everyone's at risk. But more specifically, older adults or anyone with a suppressed or compromised immune system, if they got serious underlying medical conditions, cancer treatments, chemotherapy. So those are the people we're trying to be especially protective of. So how do you protect yourself? Get vaccinated, stay 6 feet or more away from others, try to limit your trips out, and wear your PPE. If you want to do a face shield, depending on the state you're in, that's fine. If you want to do a face covering, depending on the state you're in, that's fine. But if you got gloves and things like that, I would recommend using them. And we're all familiar with working from home now. And we're probably, I imagine everybody's like me, where I have a whole bunch of virtual meetings now. But if you or a family member is sick, you need to stay home. And that's getting to be a hard one for businesses to stomach. It's like, yeah, my wife's sick, flu symptoms, I can't come into work. And we're also having a lot of people don't have that luxury of staying home because the money's run out. But one of the big things is just wash your hands and do it often, especially before eating. That's a not uncommon way of getting it. Cover your mouth when you sneeze. I mean, it's just really good etiquette. Throw it into the trash. We want to clean or disinfect common use surfaces as much as possible. Time clocks, tools that multiple people in the group are going to use. And doctors are still recommending that you contact them before you go in for an office visit. And they may want to have a virtual visit. And then wear your stuff when you're around other people. So with the response, a case of COVID-19 is a notifiable condition on your OSHA log if it was proven to be contracted at work. We are, even before the emergency temporary standard, we were required to have a plan to deal with COVID-19 and how we're going to protect employees. Here's where it can really get soupy is I have areas that, we got the federal standards and then the state does more than that. And I've even seen it where the local requirements are more stringent. So we have to keep an eye on all of those things, and you can have potential conflict between those recommendations. Because you almost never get a unified approach. But if you have a conflict between those recommendations, I generally tend to do what the bigger fish, has us to do. And you've got scads of resources. You got scads of resources for this. Well, CDC or OSHA or TPM or your insurance company, your local health commission. So there's tons and tons of resources. And the treatment, well, there's vaccine, and they're recommending a booster shot now. Most of us though will recover on our own, and you just treat it like you treat a flu or cold. But you can develop pneumonia, and that was going to require medical treatment, medical care. That's what I was talking about earlier, that if you're having trouble breathing, we need to be concerned. And there's so many different symptoms reported. Quite a few of them, if not most of them, are unsubstantiated. Just stick with the flu symptoms and then loss of taste or smell. and the difficulty breathing, and that's when we get worried. You get difficulty breathing in, you got a temperature, you should be going to the hospital. So you're going to see a ton of this. You're going to see it a lot. You're going to see this referenced a whole bunch with this emergency temporary standard and the inevitable enforcement from OSHA that's going to happen. And it's the hierarchy of controls. And so basically PPE, the face masks and stuff, that's your very last line of defense. That should be our last option. So if we can eliminate the hazard, that's even better. We're not going to really be able to substitute, but are there engineering controls that are going to protect employees? Whether it's your air handling systems or the plexiglass shields like you see at a bank. Then we've got administrative controls. That's the hand washing and the sanitizer and everything. And then the very last line of defense is PPE. And it just seems, I'm sure, kind of weird to be in this part of the presentation or into this presentation at all, but you are going to see this referenced a lot. And we'll have to do a hazard assessment about what's going on, what the risks are, and how we're protecting employees from it. So just some final COVID-19 thoughts, and then we'll get into the ETS, the Emergency Temporary Standard. The masks, well, in a way, they do protect you, but they're designed to protect others from you. And it limits the possibility of transmission if you're infected. But they do need to be washed or thrown away. And they need to go through the dryer. One of the other things is most people do not wash their hands correctly. You want to do it at least 20 seconds. You want to get your fingernails, your thumbnails, and all around each individual finger, wash all of your parts of the hand. And that is shockingly effective. But that's not an option. Hand sanitizer can be extremely effective when it's used correctly. And some of these homemade options you see online are not, they're not guaranteed to work. Let's put it that way. Recovery from this will still take years from now. That next sentence, I would say it will be over a year at best before things are back to normal, if they ever go that route. There's a ton of perceived liability, and so it makes people a little uncomfortable giving a direct or solid answer. OSHA will enforce this. There is no question. We already have to have a COVID-19 plan and a pandemic illness plan. And when the ETS goes through, they will absolutely enforce that. They've been working on it and been prepping for it for more than a year. If you run into a situation and you're like, okay, this group's telling me to do this and this group's telling me to do that, fall back to the CDC recommendations. That's your safe place. If you have questions, what does the CDC tell us to do? And then, just a reminder, this is a worldwide pandemic. And, I've heard people complain about what we're having to do in the States. I just got back from Ireland, and you have to have your proof of vaccination to sit down in a restaurant. You have to give information for contact tracing. So it could be a lot worse. And this is a lot. So there's a lot of bad advice out there. And I know you guys, none of you are going to try to inject hand sanitizer in 130-degree air, and you cannot, kill the virus by overhydrating. And at this point, at least to the medical community, there are no known herbal remedies or supplements that prevent it. And here's the hard part. We got to keep up with OSHA's, the CDC's, our state, and possibly our local recommendations. So there's a lot of information that we have to keep up with. Here's just some resources. And if you guys want a copy of this presentation, just email me and I'll send the presentation to you. But there's a ton of resources. And don't be shy about contacting me either. So here's the part that everybody I'm sure is on this presentation for. And their emergency temporary standard was published on November 5th, 2021. This is going to be the part that makes people happy. On November 12th, the Fifth Circuit Court of Appeals grants a motion to basically cease any steps to implement or enforce this until further order. So we're waiting for that Fifth Circuit Court of Appeals to come down. It's been opened up for discussion and lobbying and arguments and all that. So that's what they're doing with this now. But what it was initially set to take place was December 6th was a face covering requirement that our non-vaccinated employees will have to wear a face covering when they're in contact with any other employees. And then January 4th, that's when the weekly COVID testing for our non-vaccinated employees was set to launch. So commentary on this is what is the overreaching term that they talk about. It will be taken until January 4th, 22. That means it has to be submitted and received before January 4th. And then also too, if you've got some political clout or you got muscles there, now is the time, to flex that, because this is going to be your chance. I know of a lot of people that are just waiting to see what happens and they'll fight it then. Once it's passed, it's law, regardless of who you voted for, regardless of where you live. Once it's passed, it's law. And so we're going to talk about this as if it were going to happen and what we need to do. So widely or broadly, it's considered to have two parts. Our vaccination and our weekly COVID testing requirement for the non-vaccinated, and then the face covering requirement for non-vaccinated employees. But there's this is where I'm going to bum you out, quite a lot more to this to implement this. This is a little bit of a bigger project than a lot of people think it is. And so this is one too, where if you're an association member, I'm happy to help you with this. I've received at this point quite a few questions. When I was in Ireland, I took a phone call and email a couple times a day on these, and that's fine. I want to be able to answer your questions when you've got it, but there's way more to it than just those two things. So we have to implement a mandatory COVID-19 vaccination policy. Or if we don't want to do that, then unvaccinated employees must undergo weekly COVID testing. Well, that's weird. I don't know why that's so bad. Regardless, we have to have a list showing the vaccination status of all employees. And on that, it's applicable to businesses with 100 or more employees. That's all your locations put together. That's your part-time, that's your seasonal, that's your full-time. And we have to provide employees, if this passes, and something's going to get passed with this. It's not going to just get stopped. There'll be a version of this that comes out of this. Okay, but we have to provide up to 4 hours of paid time off to receive the vaccination, and we have to give them paid sick leave to recover from any side effects from the vaccination. And then that's a reasonable amount. How many days that is, I have no idea yet. That one's going to be one where, they'll probably, they'll figure it out when they finally pass the ETS. We're required to have employees provide prompt notification of a positive COVID result. What is the time frame on prompt? I would say within 24 hours, but that's going to be another one that gets fleshed out a little bit more as it's open for commentary. Boy, my computer's being a pain today. We have to immediately remove from the workplace any employee, regardless of vaccination status, who receives a positive COVID test. And this I expect to get much more, much clearer as this is going through commentary. Your result has to be viewed and analyzed by a licensed healthcare provider. So those at-home tests that that we take and you get an answer in 15 seconds are not acceptable. And I do expect that they're probably going to make us have a PCR test, but we'll see. Every employee who's not vaccinated has to wear a face covering when indoors. Indoors is the operative word there, or in a vehicle with other employees. We have to provide employees with information that they can understand about general COVID-19, the requirements of the emergency temporary standard, how we're going to do it, how we're going to be compliant, and what's required of them. And it has to be documented. It has to be documented. It can't be a discussion in the hallway. We need to have it documented that we did this on this date, and this is what was discussed. Okay, that'll be probably the most common thing they look for when they come through and audit us when it's finally passed. Here's a weird one that a lot of people don't realize. We have to have documented training on the CDC's key things to know about COVID-19 vaccination. So there's absolutely a requirement that all employees have seen that and understand it. So, and if you type that in, the key things to know about COVID-19 vaccines, the CDC's, their presentation will be right at the top of the list. We have to inform them that they are protected against retaliation and discrimination. But we also have to inform them that there could be criminal penalties for them for falsifying documentation. So that's really important. This could be something that really gets them if they just, falsify or give us fake documentation. Because it's, as it sits right now, it's acceptable to have an employee attestation that they've been vaccinated, because they can't find their card or because they don't know where they're put it. We have to report work-related COVID-19 fatalities to OSHA within 8 hours, and you have to report any hospitalization due to COVID to OSHA within 24 hours. And so that's going to be a sticky one, because I would tell you that if there's no proof that it was work-related or that it was that the person contracted it at work, I don't want it on your OSHA log. Don't take on that responsibility, because once you do, now you own it, and you're going to be paying for all the medical treatment and all that fun stuff. This is one I don't like, but it's in the standard, is we have to make records available to employees or their representative for their examination and or copying. And this is going to be one where your HIPAA alarms should be going off on this, and I would imagine will be addressed during the commentary, because that's a little sketchy. So how do we do it? I've told you all this depressing stuff and all these things we have to have. So how do we do it? This is what I would do. Right off the bat, I determine your employee coverage. And by that, I mean, do you have 100 or more employees? Full-time, part-time, seasonal. They can work 2 hours a week, and that still needs to be in the employee count. So it's not by, it's not by classification. It's by literally, were they an employee? We've got to determine our employees' vaccination status. It has to be documented. We have to have that list. What's probably going to be difficult is the testing, is finding that resource. You can go off-site to the doctor's office, or you can contract people to come on-site and do everybody. But we got to find out what our options are and how we think we're going to be able to do it. And then, when do we want to do it? What day? How long will the results take? With the PCR test, it's generally in that 48-hour range. So what do? We do it on a Friday, hopefully have the results by Monday, because we're going to have in our procedure. What do we do if we don't have those results? And we can make that look however we want to look, but we have to have that spelled out. And then look and see what kind of test you want to take. This is one I think will be spelled out a little bit more clearly when this does finally come through. Now here's the tricky one. The emergency temporary standard does not, oops, I got a typo there. The E-test does not require the employer to cover the cost of testing. So we don't have to pay for it if we don't want to. So we can make it an employee cost if that's what we want to do. I'm going to recommend that we cover it. And also not a lot, there's a few states that are already requiring the employer to pay for the testing. California already is. Oregon and Washington are leaning that way. But if we have the employee incur the cost, if they're getting paid minimum wage, we can't do that. The value of the test can't make them drop below the minimum wage line. That's another reason why I would just recommend, paying for it in-house. And at a couple accounts, yeah, they are going to have on-site testing done, every Friday or every Monday. It's different for a few different folks. So they just come on site and just get everybody. But then if you got stragglers or people that were missing or people who are too busy to work, we have to have, they couldn't afford to take the time to get tested. We have to address those workers too. There are paid time off requirements, 4 hours for up to 4 hours for testing. So if, we're out in, Weippe, Idaho, and we got to send people to Lewiston, Clarkston, and it's a couple, 3 hours to get it done, we're paying for that. And then we have to have paid sick leave for vaccination symptoms. I think that there'll be a time frame that comes out of this. Right now, it's kind of in the ether, just as reasonable. And we'll write in our policy that we'll give X number of days, 1 week or 2 weeks, and anything beyond that, the employee has to use their sick time. So we can write it up that way. We also have to address remote workers, and they fall out of the requirements for a bunch of this stuff. But we still have to count them, but they may not, as a lot of this won't be applicable. But then you got to determine your approach. What are you going to do? Create that written policy. And even though it's not in place right now, the ETS is not in place yet, I would still get it done. Wait to pull the trigger on it, but get it done so we know what we want to do, because that's going to help us find where our holes in our program are, or what's going to be the challenging thing. So, and once again, I've already said it a couple times, this is if you have 100 or more employees. If you're below that line, the ETS and emergency temporary standards aren't going to apply to you. So we have to develop some employee communications. We have to have documented training on, on COVID, on our procedures, on our policies, what the expectations are. They have to have documented training on that. Key things to know about COVID-19 vaccines from the CDC. That I feel very sure that that's going to be one that ends up sticking regardless of what comes through the other end from this commentary period. And we've got to establish reporting and record keeping procedures. How are we going to do that? Make sure we know every employee that's vaccinated and every employee that's not. And there's a lot of options of how we can satisfy that requirement. It could be from their medical records. They most likely will have a vaccination card. You can have an employee at the station that's saying, okay, I got vaccinated on these days. And then figure out how, and this is the hardest one, is how are we going to figure out how to do the weekly testing results? When do we do it? What's the turnaround? And then ultimately, as well, what kind of test? I do think it'll probably be a PCR. So the emergency temporary standard, once again, doesn't require the employer to cover the cost of testing. I think it's very likely that you're going to probably in California, Washington, and Oregon, we're going to incur that cost. Just remember, I know this is the second time, if an employee incurs the cost, the cost of that cannot drop them below minimum wage. We talked about the paid time off requirements. You have 4 hours off for testing, sick leave for vaccination symptoms. And we'll write that up in our policy or procedure as what we want it to be. Do we think a week is fair? Do we think, 2 weeks is what we should do? And so that'll be the tough one too. That weekly testing is going to be a big challenge. All right. We were talking about remote workers. And now my computer's acting up. Sorry about that. So it's going to absolutely change from its current version. At least I assume that it almost will certainly change from its current version, but something's going to come out the other end. Check your state's requirements, because they have, once it passes at a federal level, your state has 30 days to meet or exceed those OSHA requirements. Some states have already implemented or even exceeded the requirements. California has some pieces of that. Washington has some pieces of that. Oregon has some pieces of that. But just get your foundation set now and work through that. You don't have to launch it right now, but we don't want to wait to fight it until it's passed. Once it's passed, it's law, regardless of how we feel about it. Everybody's going to have some weird, unique circumstances, or we're going to have something that we're kind of in limbo or in a gray area. Get out clarification now. That's the benefit of getting this policy and procedure and everything done. I would get your training completed now. I would train people on what the likely requirements of the ETS is going to be. I would absolutely make sure they had it crystal clear that they know it's unlawful to falsify documentation. Because if they find out the employee, like I said, falsified it, they could go to jail. Really, I've watched the CDC video now, might as well get that out of the way. But if you go to OSHA's frequently asked questions regarding the ETS, there's a lot of pages of them, but it's going to answer just about all your questions, pretty dang close. You can make your vaccinations mandatory, but you're not required to. So you can have it you can just go the route of we're going to go the weekly testing and everybody's wearing face masks, fine. But there's going to be exemptions or accommodations we have to make on the masks and the weekly tests. That's why I think getting it built now and not launching it yet really helps us out. The record keeping on this is massively important. Whether it's a vaccination status of our employees, weekly test results every week, what we trained on, when we trained on it, on the ETS, on our procedures, on general COVID, on vaccines, a la the CDC, key things to know about the COVID-19 vaccine. But I do think that for most of my accounts, this weekly testing is likely to be the biggest hurdle. And so I would, if you have even a chance to have a vendor come and do it on site, I would really recommend to do it that way. Just we got to have a method to catch the people who missed it. And you don't have to, but I would recommend conducting it during the normal work week, so we don't have to calculate hours of however many hours of this in regular time, and then this is the paid time off. I would do it just during the normal work week, but that's not required. It's just my recommendation. So, okay, you're bummed out. We know we're going to still have the ETS come out. What's the first thing I would do? And I'm beating a dead horse big time with this. But I haven't watched that CDC video, the key things to know about COVID-19 vaccines. It is almost certainly going to still be required on the updated ETS. But when we build this now, we figure out where our areas of weakness or opportunity, that's a little more optimistic, our areas of opportunity are. But do it before it's law. Keep up with what your state requirements are. Oregon's already enforcing it. I got to find out, I'm hoping to find out today whether they still are enforcing it. My suspicion is they paused it. But don't be afraid to ask for help on any of it, on any of those things. If you're an association member and you need me to come in and conduct training, I would be thrilled to. If you got a weird situation and you're not sure if it applies or where it applies or who it applies to, I would be thrilled to help with interpretation of that. Just my final thoughts. This really is going to be the final thoughts. Is, in addition to weekly testing, one of the hardest things to do is to keep it from getting political. And that's only my only concern is, do my accounts know what they have to do? And, am I helping them be compliant? Because the law, once it's passed, it's the law, regardless of your affiliation. And in my opinion, the politics are just irrelevant as far as the emergency temporary standard goes. All it does is ends up being a discussion that doesn't help us or move us forward at all. But if you don't agree with what I just talked about, right now is the time to make it known. If you've got political clout and you can get a hold of your representative or your senators, state and federal, your governor, do it. Now is the time. If you got connections, use them. But don't wait to fight till after it's passed, because then it's law and we're required to be compliant. But regardless, you've got to be ready to do something. And so if we build our whole program, and I haven't launched it yet, but if we build the whole program and the requirements back off, that's an easy fix. That's an easy one. I don't think it's possible that it could get more stringent, but you never know. But be ready to do something. This is once again for association members. Sorry to keep saying that over and over again, but I have people watch these webinars on YouTube and then they demand that I give them the information, and they're not even close to being in the wood products or being part of the association. But that's my contact information. If you want the presentation, just email me and I'll compress all the pictures down, and I'm happy to send you the presentation. I would recommend getting working on this, and if you run into a roadblock, please feel free to get a hold of me. That is my cell. Eventually I will pick it up unless I'm on another call. Just want to thank everybody for this. I really appreciate everyone's time. And then, but don't be shy about contacting me. I'll leave this up for just a little bit longer, but that is it.